afternoon, everyone. My name is Baylor Rice. I am the owner and one of the pharmacists here at South River Compounding Pharmacy. So I'd like to welcome everybody today to our webinar on women's health. We're very excited to have a guest speaker with us today, and I will introduce her just momentarily. I wanted to start with just some real simple things. Number one, we are recording. So we do ask that questions coming in, please use your chat feature for that. And we do have everybody muted, so please keep yourself muted so as we can maintain nice, crisp audio. We will be answering questions as we go along. If we do get bogged down, then we will have to kind of push those towards the end just so we can make sure we cover all the material this afternoon. And I think that is all. Oh, also, for all those on the call today, we're very excited. Ananda has provided a raffle giveaway, so we will be having a giveaway, and we do have some free things too that we'll hit just a little while later in the program. So do stay tuned in, and we'll have some fun things as we go along this afternoon. So with that being said, we'll start with just some nice disclaimers. The FDA does not review my slides prior to, nor do they approve anything. Pretty standard jargon for this. So with that being said, for the new folks on, I always like to cover a little bit of background on us here at South River so you can understand why we do what we do and what got us into this. We are really the first modern day compounding only pharmacy in Virginia as well. We're the first natural medicine pharmacy in Virginia. So we do specialize in vitamins, minerals, herbals, homeopathics. We're all about keeping your bar as high as we can. I use the terminology optimal health versus anti-aging. Personally, I think anti-aging is hokey. Anti-aging, really, if you look at the definition, it means you're not aging, which means you're dead. So I like keeping the bar high and up and optimizing your genetics. So that's what we're all about here at South River. So we do offer personalized consultations. We've got a whole variety of different tests that are available that are outside of your normal medical practitioner realm generally. So we're about really trying to get to the root cause of issues, just putting Band-Aids on. So that is just a little bit about us for those that are new. So now, really to get into why everyone's tuning in this afternoon is really to hear Dr. Alex Capano. So very excited to have her join us today. She is a senior fellow at the Institute of Emerging Health Professions, St. Thomas University, faculty at the Lambert Center for the Study of Medical Cannabis and Hemp at Thomas Jefferson University, and the only doctorate in endocannabinoid science. As well, she is a chief science officer at Ananda Professional. So very honored and happy to have you with us here today, Alex. Thank you for joining us.
Thanks for having me, Baylor. Okay. So I like to always do a brief introduction to hemp and CBD. For those who have joined us, you may have tried and love CBD, or you may be a little skeptical and have some trepidation. And that's reasonable because there's a lot of hyperbole, in this industry. On one hand, you have this is, the miracle cure for everything and everyone all the time, and that's not true. And on the other hand, you have, this is the devil's jazz cabbage, and that's certainly not true either. Either way, the CBD market is here, it is booming, and there's a lot to unpack. So sometimes I go into a store and I see something that looks like it's a CBD product, but it just has hemp seed oil in it, right? And hemp seed oil doesn't actually have any CBD in it. So you really have to look at the packaging. And then even when it is a CBD product, we know that the industry is really bogged down due to lack of regulation. So over half of the CBD products out there don't match their packaging, so you're not necessarily getting what you pay for. And the quality control, again, isn't regulated, so you may have some contaminants in that product. And some companies make all sorts of claims. And then there's different types of CBD products, full spectrum, broad spectrum, isolate. What does it all mean? We'll briefly refresh that. And then lastly, there does seem to be CBD in basically everything at this point. And you might wonder why. And the reality is some of those products are gimmicks. You don't need CBD in your mascara. It's not going to hurt you, but it's not going to do anything to your eyelashes. And people may think CBD for women's health, I've never really heard about that. It doesn't make sense. But I hope today I can help you understand that this is an evidence-based use case, and we really don't create products that don't actually have evidence and scientific backing. So refresher, for those who may be confused, hemp and marijuana are both cannabis plants, and those words are actually legal definitions in the US. So a hemp plant is really abundant in CBD. It's not going to get you high. It's federally legal now, and you can get it over the counter without a prescription. Even if you feel like you might need one, you don't. What is considered a marijuana plant is a cannabis plant that has higher levels of something called THC. That is the compound that is responsible for eliciting the high or euphoria that we think of when we think of marijuana. It can have CBD in it. It often has lower amounts because the more THC you have, often the less CBD you have. It's not federally legal, and you can't get it over the counter. And you can't get it anywhere legally in some states. So that's the biggest difference between hemp and marijuana. One, really rich in CBD, hemp, and won't intoxicate you, whereas marijuana may not have a lot of CBD in it, but it will intoxicate you. So CBD, we say not psychoactive. I like to say not intoxicating because this is something that can actually reduce anxiety. We know it's actually an antipsychotic. So to me, those are beneficial, but they technically are psychoactive if they're improving your mood. But the difference is it's not going to intoxicate. It's not going to get you high. You could try really hard and you will fail. It does have very wide therapeutic potential across a number of different conditions and symptoms, and it's very well tolerated. So well-established safety profile, especially at doses that people can find effective therapeutically. The safety profile is really excellent. THC, on the other hand, that is highly regulated, not federally legal, certainly has therapeutic aspects and potential, but it comes with those additional risks. So one, intoxication. Two, it can actually induce anxiety and psychosis. So it works in the opposite way in the brain that CBD does. And it's also potentially disruptive to a maturing brain. So before the age of about 25, your frontal lobe isn't really fully formed. We see that THC can actually slow that maturation. Once you've reached 25, it's not going to do anything. It's not going to set you back. But if you use it before then, it can actually slow that maturation. Whereas CBD works in actually the exact opposite way on those receptors in that frontal lobe, so we don't have that risk. So the biggest difference, other than intoxication, is that CBD has better therapeutic potential in that it is better tolerated, lower side effects, lower risk. So how do these work? They work on something called the endocannabinoid system. So unfortunately, the endocannabinoid system is not even widely taught in medical, nursing, or pharmacy schools yet. It's getting a little bit better, but it's poorly understood by many, if not most, healthcare practitioners, let alone patients and consumers. But this is a really important system for really everything that our body does every day, every hour, every minute, every second, while it's keeping everything in balance. So this system is made up of these receptors that are abundant in your brain and your spinal cord. They are also in your periphery. So they're on your immune cells, they're in your digestive tract, and they are definitely in reproductive tissue. So these receptors regulate everything from appetite, mood, your sleep-wake cycle, your temperature control, your pain, your pleasure and reward, your hormonal balance, your immune function, inflammation, and as you can see, the list goes on and on. This is Dr. Raphael Mechoulam. He is often considered the grandfather of cannabinoid science, and he says, I cannot list all of the physiological systems and conditions affected by cannabinoids because there are too many. I make a point to share this most of the time when I give presentations because I do want to dispel that snake oil myth. No, you don't need CBD in your mascara, but because this system is hitting so many different targets across all organs and organ systems within your body all day long. Once you understand that, you start to understand, okay, that's why there's so many different clinical applications for cannabinoids and specifically CBD. So while CBD is really our champion, I don't want to discount the other cannabinoids and compounds in the plant when you use them all together with something that's called full spectrum. From a hemp plant, you get something called the entourage effect. That means you get a greater response at a lower dose. So you get to take less of it and you get even more therapeutic outcomes. So this is what a full spectrum product would look like. That means it's going to have that trace amount of THC that's found naturally in most hemp plants. It is federally legal. It's low enough to not intoxicate, but present to improve therapeutic outcomes. Now, some people can't take any THC whatsoever. Maybe they don't want to risk the potential of failing a drug test or something at work because that is what they will test for. And it is possible, if you even have a little bit, you could fail a drug test. So the next best option for that would be something called broad spectrum. That means there's no detectable THC, but you still have all of those other compounds that help improve your therapeutic response. And lastly, there's isolated CBD, which is just crystallized isolated CBD. Does have therapeutic potential, but you have to take a lot more of it to get a response, and that peak of response is going to be lower. So for example, if you took 10 milligrams of a full spectrum and you got an 8-point improvement, you would have to take 100 milligrams of an isolate and you might get a 5-point improvement. There's still an improvement, but it's not as much and you have to take a lot more. We are a company that, manufactures quality CBD products from our hemp. But I would say that research is really in our DNA. And I think that's important because of the snake oil, because it's not a regulated industry, and because people want information on safety and efficacy. So we've invested quite a lot in research. We published a study on opioid reduction and chronic pain. We found that our CBD actually helped reduce opioid use. It improved pain. We're looking at sleep and the improvement of sleep across hundreds of individuals all over the continent of Australia. And we actually have some phase 2 clinical trials looking at neuropathic pain, looking at anxiety and sleep in dementia patients. And I'm really excited, and I can share some information on this. We have just launched a study looking at endometriosis, not just the pain associated with it, but the actual disease of endometriosis. So we're really focused on women's health right now, and we're really excited about the early results that we've seen. So women with endometriosis, it's actually pretty common. So about 1 in 10 women have endometriosis in the US at least. And this is something where endometrial tissue grows outside of the uterus where it's not supposed to be. And it can cause pain, it can cause mood disorders, pretty severe pain, bloating, and is actually associated with about 30% of infertility cases. There's really not great treatments out there for it right now. Some of the treatments that are recently FDA approved for it actually induce menopause, which many women do not want to have in their 20s, 30s, 40s, or just before they're ready. And unfortunately, yes, Sometimes it can be treated with some over-the-counter pain medications, but you're really just treating the symptoms, which are important to treat, but you're not actually treating that underlying cause, those lesions that are growing and causing this, pretty severe pain condition. So we are partnered with a group of researchers at the University of Newcastle in Australia, and they had a hypothesis that CBD would reduce endometriosis pain and lesions. I said, I completely agree. And I'm really excited because we have launched this study actually in March of this year, so last month. And what we're finding is that the CBD doesn't only affect the nerve and therefore the pain, but actually reduces the growth of the lesions. Now, that's pretty remarkable. If any of you have endometriosis or are familiar with it, we are not seeing that kind of results with the medications that have been available for a really long time. So not only treating the symptoms, but actually the underlying cause. And we came up with this hypothesis because, as I mentioned, those receptors of the endocannabinoid system, or the ECS, they are really abundant in female reproductive organs. And so it's really like a perfect therapeutic target for cannabinoids because it's just ripe to accept them. And then these endocannabinoid receptors, as I mentioned, they influence everything from mood and pain and pleasure. They actually influence libido, they influence lubrication, they influence, again, inflammation, pain, pleasure, but they even influence things like egg maturation and embryo implantation and your hormonal balance with that HPA axis, which is really important for the menstrual cycle. So kind of all of those women's health that gynecologically is regulated by endocannabinoid receptors. Again, not going to put CBD in something just because it's a bandwagon product. We're going to put it in there because we know it's going to work. And there's been some research to date on this. And what we've seen is that, yes, these receptors stop those endometrial lesions from growing. We see that there's a lot of signaling with these receptors. We've looked at it in animal models and we know it's associated, but no one's really looked in humans yet until we're doing this study now. This is just a collection of results from studies. I won't go into it, but I wanted it there for those of you who may really want to look at some other results of animal data in the past. So to go back on this study, we are looking at what's called human organoids, or avatar models. Now, that's not the same as putting a bunch of cells in a petri dish and seeing what happens. Not that that type of research isn't valuable, it certainly is, and it's a great first step, and that's what we had before. But when you think about, okay, if I put, for example, particular lung cells into a petri dish, and then I tried to treat it with something, it's not necessarily going to react the same way as it does in the body with all of the different blood vessels and nerves and other tissues and cells that exist in the human body. So it doesn't always translate. It actually often doesn't translate to real world application. And then what's really difficult about treating and studying endometriosis is technically you can't even get a diagnosis without surgery. So that's very difficult. There's really no reliable imaging for endometriosis. So how can you tell if the lesions are being treated? Because you can't just continue to surgically open up someone's abdomen and look inside of those lesions. So this technology is really groundbreaking, and it's called human organoids. What that means is you essentially get a sample of that organ from a human with this condition, and you grow it in a lab, and it reacts the same way as it would in the human body because it has all of those different cell types and is essentially a living organ outside of the body. But of course, the patient doesn't get hurt. So that's how we're able to look at endometriosis. We're able to look at nerve involvement. We're really able to look at tolerability and how safe it is on those cells through this groundbreaking technology. And to be perfectly frank, I'm impressed by it and I understand it, but I don't even know how they make these organoids really thrive outside the human body, but that's not my job. So we are looking at that right now. And I'm really excited because I do have permission from Dr. Pradeep Tanvir, who is the principal investigator on this, to show you. And if you're like scratching your head and what does this mean? And I didn't come for a science lesson, don't worry, because I'll break it down. It's actually very easy. Those big cells, can you see my cursor? Okay, you can. So those big cells, those are endometrial lesions, right? And this vehicle control, that means basically the placebo, right? And these are different concentrations of our extract, just diluted, as it typically is in any product with an oil carrier. And as you can see, at 250 nanograms per ml or micrograms per ml, those lesions are completely gone, right? They're gone. And then they kept going down in the concentration, and they went all the way down to 50 micrograms, and they still saw that kill. So you can just see it with the naked eye, right? You don't need to have a doctoral degree in a scientific field to understand this. Those lesions are gone. We actually found out as they continued to go down that they could go as low as 10 micrograms per ml. That's a very, very low concentration. And they still got this level of kill. So to me, that was really exciting. Typically, you have to interpret results with a ton of analysis and graphs and numbers and try to see, is there any sort of meaningful difference? But this is meaningful, and I think we can all understand it. And again, at that really low concentration of just 10 micrograms. Our products are much more concentrated than that, so you're certainly going to get at least this, but they are still safe. So we know the tolerability of the level, the concentration of our products. So you're not going to get anything that's going to harm you, but you're going to get plenty of bang for your buck as far as therapeutic outcomes. And we're going to switch gears a little bit because I feel like when I talk about women's health, or when I hear about women's health, we really just talk about pain. We talk about all the negative stuff. And that frustrates me as a woman. It frustrates me as a healthcare provider. And typically, most of my patients are women, and I focus really on sexual and reproductive health. And, an important question for women is, are you enjoying life to the fullest? Are you able to have pain without sex? Are you able to get in the mood? How's your libido? How is your satisfaction? And, people really want to have those conversations when you bring them up. And that's not just like my millennial patients. This is every woman cares about this because they are human beings who deserve joy, right? So what we know is that cannabinoids, yes, they affect endometriosis. They affect pain. They affect your menstrual cycle, but they affect pleasure. They affect lubrication. They affect libido, and they actually affect orgasm. So there's been some studies done, and when a woman actually achieves orgasm, these endocannabinoid receptors fire. So if you prime them with a plant-derived cannabinoid like CBD before, it just makes that firing happen a little bit easier. And then we also see this study that came out pretty recently, about 18 months ago, and it looked at about 400 women. And if they used cannabinoids, particularly CBD, before a sexual encounter, it increased their likelihood of what they considered a satisfactory orgasm by 100%. It doubled it. They also reported decreased pain with sex, increased libido, increased lubrication. So maybe if somebody is having a problem with libido or lubrication, or they're dealing with painful sex, yes, this is an area for therapeutic treatment. but maybe they just want to bring some spice or some more joy into their life. And this is a way to do that too. You know, we don't always have to have a problem. We can just seek a little bit more joy. And we have really tried to address these different areas of a woman's life through our Ananda Bliss clinical products. These are our women's health products. And I'm going to explain them all to you because they're pretty different. And one might resonate with you when you say, oh, that makes so much sense for me. And that's great. I do want to say that for me, and I think for a lot of people, all three products are appropriate at different times and to achieve different outcomes for what you might want that day or during that time in your cycle or for whatever you're going through. So first we have our intimate oil. Now that is, I like to say it's recreational, but I don't want to say recreational in the CBD space because it makes people think the wrong thing. What I mean by that is this is for fun. This is for a sexual activity, and it is just to make it that much more arousing, make orgasm that much easier to achieve, and really to stimulate and heighten sensations, as it says right there. But it truly does. Yes, of course, you're going to have some of that anti-inflammatory effect and some increased lubrication. And if you have pain with sex, certainly this will help, but it is quite stimulating. So if you're just trying to deal with pain that may not only be brought on by sex, go ahead and use it all day long if you want, but you might not want to because you will certainly be feeling our intimate oil. So that is something, again, to enhance pleasure because that is an important part of anyone's life, but especially women's life. And then on the other end of the spectrum, we have something called the Endo Relief Cream. And we developed this because pelvic pain's real. And I actually started doing research on it in the real world. What does the data say? Because certainly I see it in practice all the time, but that's a segment of patients that come to me because that's what I treat. But what I saw was, one, yes, so many people have endometriosis. It's quite prevalent, about 10%. But over 80% of women of all ages, even postmenopausal, complain about pelvic pain. And 97% of them, so almost every woman, is treating it regularly with medication, and it's not really helping, or it has side effects, or it's not great for your GI tract. And most of them are missing work or missing school because of this pain. So it's interrupting their life, it's decreasing their quality of life, and it's real. And I think that, we're really tough as women and we don't necessarily talk about it all the time or complain about it, but it's certainly there. So this Endo Relief Cream is incredibly concentrated. I mentioned that you don't need a high concentration to get those kills on the endometriosis lesions, and that's true, but different concentrations lead to different outcomes, right? So yeah, okay, maybe your lesions are going away, but maybe you don't have endometriosis, or maybe you're just still having pain. We want higher concentrations to decrease that inflammation overall. And then we want even higher concentrations that decrease our perception of pain. So we want to treat the underlying cause, whether that's inflammation or whether that's something like endometriosis, absolutely. But we also want to treat the symptom while it's happening, right? Because that's about quality of life. So with this product, that high concentration is going to have a rapid onset. I mean, really within 20 minutes, you should get some relief. And it goes straight to the receptors. So this is an intravaginal product. If you think of a Monistat or even a tampon, it has an applicator, it's reusable, rewashable. And I think everyone's pretty familiar with how to use that. So you can imagine, goes straight to those receptors right there, rapid onset, and very concentrated product. This is something that is nice and thick with shea butter. But you might want to lie down for 10, 15 minutes. And if you're in that sort of pain, you probably want to lie down for 10 or 15 minutes anyway, or just use it at night. In the middle of those two products is something I'm really excited about, and it's our Flora Balancing Gel.
Alex, can I ask a question about the other
Please
first?
do. Yeah.
So is that a broad spectrum or is that a full spectrum
It's a
CBD
full
that's in it?
spectrum.
So a question would be if the systemic absorption of the THC, does somebody that's having to worry about drug testing have to worry about that using it intravaginally?
If someone failed a drug test because of systemic absorption of THC intravaginally without a carrier that's meant to help that systemic uptake, and this does not have one, I would bet all of my money that that would not happen. Now, I will tell you that we have not tested that in a clinical setting over and over with people who are only using THC that way. So I cannot show you a clinical trial that demonstrates that, but from everything that I know about cannabinoids and how the body metabolizes them and this product, like I said, I would bet the farm that no, you would not fail a drug test.
Okay. And would that be extrapolated? Of course, then you were just talking about the Endo Relief Cream, but also the Flora Balancing and the Intimate
Yes.
Oil is
Yes.
all of them have
All of them.
cannabinoids and certainly the Intimate Oil having the fewest out of all of those. Okay, great. Thank you.
So that's great question, and that's true for all of them. So this Flora Balancing Gel, that has 750 milligrams in the bottle. So as you can see, it kind of goes up in concentration from the Intimate Oil to the Endo Relief Cream. The Flora Balancing Gel is right in the middle. It's still pretty concentrated. And those cannabinoids within the Flora Balancing Gel really just increase, density of the tissue. So somebody who may be dealing with some atrophy, they help actually balance the flora, but we have some other ingredients in there that do that as well. It decreases that inflammation over time. It increases lubrication. But there are other ingredients in this that I'm really excited about. So these ingredients are prebiotics, which means, and they're selective prebiotics. So we all have a microbiome, right, on our skin and our digestive tract, but the vaginal microbiome is really important and really sensitive. And that means that you want all of these microorganisms and you want a lot of the good ones and you don't want a lot of the bad ones. And when you get an imbalance of that microbiome or that flora, that's when we see itching, discomfort, irritation, dryness. That's when we see yeast infections. That's when we see something called BV, or bacterial vaginosis or vaginitis. That is, I'm the most common complaint I see in the office is BV. I feel like, there's not a lot of commercials about it. People don't talk about it, but it is actually more common than yeast infections. And both yeast infections and BV are often chronic. If someone is prone to them, they get them, every month or every couple of weeks. And if you treat BV, for example, you treat it with an antibiotic, you actually can cause a yeast infection and vice versa. So, I see this kind of revolving door. And one of the things that often causes BV, which again is just an imbalance in that flora, is really feminine hygiene products, right? And I would tell my patients who are prone to BV, like, please stop using these products because they're causing this, and I'm just going to see you again if you keep using them. And I had to learn. I had to correct myself because I was being really stubborn, because I was trying to tell these people to do something that they enjoyed, not only enjoyed, but was, part of their ritual, part of their maintenance, part of maybe their culture, part of something that made them feel good. And they just didn't feel right. They didn't feel fresh. They didn't feel clean or feminine if they didn't use something that they felt, was addressing feminine hygiene. So this product is something that serves that purpose of, that feminine hygiene, that refreshing, that ritual that is really important to a lot of people. but it's not going to cause those issues. It's actually going to prevent them from happening because it was, developed clinically by myself and a lot of other people who know how the vagina works and how to keep that flora healthy and in balance. So this is a great everyday product, not only for, refreshment, but for prevention of those recurrent conditions. Certainly, if somebody gets put on a medication for something like a yeast infection or BV, or even if they're taking an antibiotic for, strep throat that can cause a yeast infection, get the Flora Balancing Gel. You hear like, oh, eat yogurt. Sure, eat yogurt, but that is not going to directly impact the vaginal flora as effectively as something like this. It does have a little bit of stimulation, not on the way that the intimate oil does. So this is definitely fine to, go about your business all day. And I don't think anyone is going to know what's going on, but it's nice because that does increase vasodilation. It expands the blood vessels. So that increases pleasure. It increases libido. It increases lubrication for people who deal with dryness. And I think I mentioned this, but it actually helps to redensify the skin as well. And what's so exciting about the Flora Balancing Gel is it is water soluble, which means it's condom compatible. So if someone is using condoms for contraception or for safety, those other two products are oil-based and they should not be used with a condom because it can actually break down the integrity of it. But this one can be. So, go for the Endo Relief Cream after you have a sexual activity with condom use if you need it and are having pain. But this Flora Balancing Gel is, I joke, I'm like, it's your best friend, but it really is, because it's something that I think everyone can benefit from, whether they're prone to issues, whether they just want to feel fresher, whether they want to prevent something, or whether they want to, spice things up. This is something that's really just going to keep that microbiome very healthy and happy. Oh, well, look at me. I just talked about all these different ingredients in it, and I didn't even have it in front of me. So if you want to learn a little bit more about the different ingredients I was just mentioning, for example, the arginine and the ginseng, that's going to get that little bit of stimulation, that whisper of stimulation, not as intense as the intimate oil, but it's certainly there. So if you're still not sure what each product is for, I wanted you to look in this table and think about, do I take any of these, or have I considered any of these medications? Some of them are over the counter, some of them are prescription. If you do, if you've considered it, if you take them often and maybe want to substitute or a companion product or want to go off, certainly talk to your pharmacist. But this is hopefully, if this is, you're more of a visual learner and this starts to make sense of what are these for, I hope that, this speaks to you and helps to better differentiate what each product is trying to do. And that's why I say, one person can certainly use all three, depending on what she wants to achieve that day or what she's dealing with that day. And we talk about women's health, and I feel like we have to talk about skin, right? I mean, health and beauty are connected for everyone. And I think as women, we are pressured about beauty and we care about it. It makes us feel good. And also our skin is our largest organ, and we show it to the world every day. And it's influenced by hormones. So, whether it's, changes within a menstrual cycle, whether those are post-menopausal changes, whatever it is, our skin and its appearance and health is influenced by hormones. And then the skin is also a great vehicle or opportunity for cannabinoids. the same reason as female reproductive organs, because it is really just a magnet for cannabinoids because it's abundant with receptors. It's not as abundant as female reproductive organs, but it's still pretty abundant. So these CBD products actually just really do a lot of work on the skin. So topical. And we know that CBD actually helps stop damaged skin cells from proliferating or, producing, gets rid of the bad guys. But it actually helps to increase the production of healthy skin cells. It's certainly anti-inflammatory, and we want that, but it reduces excess sebum. It's actually moisturizing. It's not going to dry you out, but if you have a sebaceous, so this basically the cells that are responsible for producing too much oil that can cause blemishes, it stops it if it's in excess. So it's not drying, but it's really just balancing. And then what we see is that it actually reduces and kills P. acnes bacteria, which is the bacteria that is associated and causes acne. We partnered with a third-party lab in California at the end of, I believe, 2019, and we found that our extract, our Ananda extract, kills P. acnes bacteria at over 99.99%. It does it very quickly, and it does it with, again, a very low concentration. And then what we looked at is people use, for example, for acne, like a topical clindamycin. And that's a topical antibiotic to try to kill that bacteria. And it'll work, but it won't work for that long because the bacteria learn how to fight back and they become resistant. So I wanted to know, okay, great, we've got this kill. Well, are the bacteria going to figure out how to fight it and resist it? And they do not. So that took a really long time to try to get them to learn how to kill our extract or fight back our extract, and they couldn't do it. So that's nice because you don't need a second product. You don't need to put, benzoyl peroxide with your antibiotic. It really dries out the skin. It can bleach your skin. It can bleach your clothes and your pillowcases. Doesn't smell that great. So it's really just not that nice to use. This is definitely an option for people who are prone to acne, whether that's all the time or whether that's at certain times of their cycle. And again, for those visual learners who like my science graphs, this is just showing you. So this is the control. That means basically we plated a bunch of P. acnes bacteria. We let it grow. We didn't put any of our extract on it, and it kept growing. And then we put different concentrations of our extract in these other ones. And as you can see, the first time point we tested was 6 hours. It may do it in 20 minutes. We don't know because the first one we tested was 6 hours and it had killed it at very low concentrations. So we want to talk about menopause because we're really talking about all women throughout the lifespan. I talked a lot about menstrual cycles. I'm talking about acne, but I want to talk about menopause too, because, hopefully all women get to experience it because if they live till 45, 50, that's going to happen. Most of those women will experience symptoms. And that's not just like a week, a month. It is most days for almost a decade. And there's a lot of symptoms. And those symptoms, when they're not treated, cause long-term negative health outcomes. So this isn't, I don't want to feel bad every day for 7 to 10 years. But I also want to live a really, really long time and, become a great grandmother or something. So what we see with these symptoms when they're not treated, it increases rates of heart disease, which is actually the #1 killer of women. There's certainly a decline in mental health if you're not feeling well. There can be, with some treatments, an increase in certain gynecological cancers. So, you might be treating one thing, but you're causing another. People don't want that risk, understandably. And we also see this high rate of osteoporosis. And what's interesting is that osteoporosis is actually associated with cannabinoid receptor decline. So when you go through menopause, those receptors that are everywhere, you lose some of them. And that's partially responsible for bone loss, but particularly for menopausal bone loss and osteoporosis. So again, like with orgasm, you want to prime those receptors. You can do that through phytocannabinoids. You can do that through CBD. So you may have fewer receptors postmenopausally, but you can get more out of them by using a CBD product. We know that the endocannabinoid system plays a really important role in body temperature regulation. Think about hot flashes, but certainly mood disturbances, vaginal lubrication, as I mentioned a number of times today. Inflammation, pain, pleasure, skin cell turnover, right? We lose our estrogen and then we don't feel like our skin, is as elastic anymore. It might lose some of its vigor and its life. And that's a reason many people are going to use estrogen. And that may lead to some long-term negative health outcomes that I just mentioned. No judgment. I'm not saying don't use estrogen in menopause, but it may not be the best choice for everyone. What we're seeing is that CBD suppresses dominant estrogen. So when you have too much, and that can lead to those negative outcomes, it actually helps to balance that out. And it does this by inhibiting a particular enzyme. I don't have to go into the science lesson again of it. I go down that path too often. But just know that it can keep estrogen within that healthy balance and within that level that the body is going to respond to it and then not have negative outcomes. Other conditions or symptoms associated with menopause, everything from inflammation, joint pain, painful sex, reduced libido, but even restless legs, so RLS, that's actually really common with menopause. So we have a number of products that, yes, we have our Bliss Clinical line, but we have our beauty lines. We've got our Hydrating Glow Serum that actually I started using, and let me tell you, my skin changed. I should have started using it sooner, but it's wonderful. We have our cooling lotion that is just really nice, and hopefully my brother-in-law, who is not a postmenopausal woman, but he is finding some really incredible relief from his restless leg syndrome. And we even have our cooling comfort socks to help address all of these different symptoms, this constellation of symptoms that people go through when they experience menopause. Even joint aches and pains, we've got topical and ingestible as well. So Bliss Clinical, think very intimate intravaginal application and use, but there's certainly other symptoms associated with women's health and particularly with menopause that can be addressed through cannabinoids. So how do you pick a product? Luckily for you, you have a really great guide and someone who's vetting products for you through South River Pharmacy. And that's really important because, as I mentioned previously, most products don't match their packaging right now. This is not a regulated industry. The FDA previously saw that over 90% didn't match. It's gotten better since 2016. It has, the industry's improved, but still over half don't match their packaging. And that's not only about, wasting your money and not getting the dose or the milligrams you think you're getting. It's also about making sure there's not contaminants in it, that there's not chemicals, there's not heavy metals, there's not microbes or molds that you're putting on your skin or in your vagina or ingesting. And not even residual solvents, because there's chemistry that has to be done to get these cannabinoids into your end product from the plant. So if you don't have good quality control, if you don't have rigorous testing throughout that process, you could end up with something that could have harmful products or contaminants in it for your body. I'm not trying to scare anyone. I'm just trying to be real that does exist out there. So what do? Well, again, you guys are lucky you have South River to do that due diligence for you, but you ask for a certificate of analysis. Again, this is one of those really boring lab things that I love, but you look at the concentration. Is there really the level of CBD or other cannabinoids in there that I want to be in there? Is it pure? Did they test for all those contaminants I just mentioned? And is it done by an objective third party? You know, you don't want the manufacturer saying, oh, yes, look at our documentation. They need to have someone else outside double checking that for you. And that lab needs to be reliable. So that means ISO certified, and ISO certified in the areas that they're testing. So labs can be ISO certified for X, but not for Y. So they need to be ISO certified for everything you're looking at. And it also needs to be lot specific. I know this sounds obvious, but I do see companies out there, they have like one COA and they've had it for 5 years and it's for every product ever. You want to make sure that that COA is actually reflective of the product in your hand. That product should have a lot number. Your COA has a lot number. They match. And it should be readily available. You guys should not have to hunt this down. You shouldn't have to, you know, get on the internet and find an email and try to track it down, because that's a lot of time. What you want is something that's accessible, it's compliant, it's legal, it is safe. So on all of our products, we have a QR code. I think we're all more familiar with them now than we ever anticipated. And you just scan that, you've got that lot number there, you type it in, and you're going to get your COA. So again, you are at a trusted pharmacy who's a community leader and is doing this due diligence, but try it out, see what it looks like, you know, have a little experiment, and then demand that of products. You want transparency and you want easy, accessible transparency. And thank you so much. We're going to take time for questions, but I think Baylor wants to do some review.
Yeah, thank you, Alex. That was wonderful. I generally like to kind of recap as when I go to presentations and everything, I always want to, let's kind of get focused. Let's do a quick recap. So that was a lot of information.
Yeah.
And what do I need to do? What can I do? So I like kind of starting simple. And I was asked years ago, you know, Baylor, what are your top picks, right? So that's what we've really just kind of named it. So I like putting everybody on a good therapeutic multi. We use our phytonutrient multi, which is a food-based multi with methylated Bs. It's really designed at protecting the DNA of the cells. So that's where we have to worry with the aging process and oxidative damage. So that's really doing a heck of a job with that. Fish oils, I like omega-3 essential fatty acids, good for everything head to toe, getting a good solid level of vitamin D to help protect the bones and especially the immune system right now. And then, of course, just a baseline of CBD, doing it systemically. Really, for everybody 35 and over, I have CBD as that baseline. And Alex went over a lot of just everyday reasons within here, right? From inflammation, brain function, but then also as we get older, helping to protect the bones. And then the three main products she went over, certainly the intimate oil. So that, as she alluded to, that can be on everybody's list, right? Let's have some fun. Let's have that intimacy with our partner. So very important. And then the other two, really the Endo Relief Cream, if you're having that that pain, if you've been dealing with endometriosis, if you've been having discomfort and painful intercourse, then yes, have that on the list. The Flora Balancing Gel for that bacterial vaginosis. So very important. And then of course helping with some dryness as well. So those are some kind of things to have in your arsenal, if you will, at home. Oh, there we go. So what next, right? So you can start on the baseline supplements. Certainly you can stop in the store, you can do curbside service, we can certainly ship to you. We're certainly expanding the online store every day. All of these products that Alex has gone over today are in the online store. And certainly if you have questions, feel free. You can put in the cart, you can call the store, you can send us an email. We are absolutely here to answer your questions and make sure you get taken care of. Allison is our patient care coordinator. Her email is patientcare@South River RX. So if you're a patient that, wow, you know what, I've got a lot of intricate disease states, I'm complex, then absolutely let's get you set up for a consultation. We may even want to look at some hormone labs. Can we do these things and also integrate it in with the bioidentical hormones? Absolutely. It is, as I started off this afternoon, it is all about optimizing your health. It's all about getting that bar as high as we can, keeping it there, and pushing back long-term disease. And then, of course, the consults right now we are doing via phone, WebEx, or Zoom. So anyway, keeping that really kind of simple. If you don't mind, give us a review on Yelp, Google, Facebook, like us on the various social media channels. We do have and offer different specials on those to really kind of encourage that. And then, of course, signing up for our email newsletter. And I always promise everybody I never have, nor will I ever sell your information. And we got a note in from Miss Jones. Thank you. So excited. Look forward to trying the much needed product. So fantastic, Miss Jones. So very excited for you. So at this point, I do want to open it up to questions. I know we've had a few questions along the way, but certainly use your chat feature there. Put in questions. You've got the opportunity to ask an absolute expert and wealth of knowledge here today. So please take advantage of it. And while we're waiting, again, Alex, I really sincerely thank you so very much. We appreciate having you on with us today. And for those, while you're putting in your questions, we are having Alex is going to be back for practitioners. So we are having a practitioner presentation on, is it May 20th, I think? Is that the date? So if anyone has a practitioner that they think would be beneficial, we're certainly reaching out for all of those that we are working with. We're going to be getting the facts out today. But certainly, again, you can share that with Allison is probably the best contact. If you've got a friend that's a practitioner or have a close relationship, let them know about it. If you enjoyed it today, we really want to get the practitioners in the area educated, as well as do have it open to their medical staff too, because I think it's very important for the nurses and triage to be educated on what we can do to help. So we did get a question, and I already used 500 milligrams of CBD to help her sleep. Post-menopausal woman of 59. If I up my dose, what else could it help me with?
Are you sure you're using 500 milligrams of CBD every night, or is the entire bottle or product that you're taking 500 milligrams? The reason I'm asking is 500 milligrams is a very high dose to use every day. So if you added more to that dose, I do not think you would get any additional benefits. If, for example, you're using 20 or 30 milligrams, even 50 milligrams every day to help you sleep, and that is working for you to help you sleep, I wouldn't suggest changing it. And okay, so you get it from Baylor.
And most of our patients, I generally start our patients on about 15 milligrams.
Yeah.
And then keep increasing it about every 5 days up until the desired effect, or if they start getting daytime sleepiness. So I would say probably 90% of our patients are somewhere between that 15 and 60 milligram mark. Is where the majority, certainly our chronic pain patients, I do have some that certainly go above the 60, but I would say she's probably in that 20 to 30 milligram space.
Okay, so talk to Baylor and we can figure out what you're really taking every night. If you are taking, let's say, 20 or 30 every night, it's helping you sleep, you're getting that benefit, wonderful. If you have something like joint pain or any sort of pain that is not being addressed, increasing your dose or even taking a second dose that's a little bit lower in the morning can help with that. As far as other postmenopausal symptoms, assuming, again, the dose that you're on is at least 20, 30 milligrams a day, I'm not going to tell you to up it. I would tell you to add a smaller morning dose just for some of that protection from, losing bone density. But more importantly, if you're having menopausal symptoms of anything to do with your skin, anything to do gynecologically, then something like a topical or an intravaginal, you could certainly get some different benefits by that sort of delivery than you do with using it to help you sleep. So I've got to be honest with you. If it's working for you to sleep and you don't have something like pain going on, a smaller dose in the morning just for that anti-inflammation and increased bone density, but otherwise, a different delivery, because you don't just need more to do more things.
Yeah, no, that's great. And she said she doesn't have any pain, and she was confused
Oh,
about
good.
the
I'm glad you
milligram.
don't have pain. Good to hear. Happy for you.
And most of our patients, I dose them 2 to 3 times a day. So, Alex,
Oh, good.
I don't just generally push it all to bedtime unless that's the only issue they have going on is sleep and winding down at night.
Yeah.
I do believe in getting that dosage more throughout the day and spacing it out. I have found clinically we're able to get away with fewer milligrams in the course of the day by doing that. Now,
Yeah.
so for me, I'm always trying to save folks money where we can, and also get the best relief possible. So that's generally how we go about it.
Great practice, same page. And I just want to mention to the person who asked the question, you are not alone by being maybe confused on milligrams per ml and how much am I taking and what. That is an industry-wide label issue, and it's unlike anything else we kind of see over the counter. So I hope that you feel reassured that that's not your fault. You're not alone. Super normal.
Don't see anything else coming in. Certainly, if anyone thinks of anything later, we're here. Reach out to us, stop in, give us a call, pop us an email. Happy to help you anyway. Again, Alex, I can't thank you enough. Thank you so
Thank you.
very much.
Yeah.
We appreciate it. Hope you have a great day, and everyone, you guys have a wonderful day and enjoy the upcoming weekend. Thank you.
Bye.